Greetings and salutations. Thank you for lending an ear to the voice of the times this Monday, November 1, 2021. For today's editorial, Healthcare Underspending Slowing Down Vaccine Drive. Like the rest of the world, the Philippines is racing to vaccinate as many people as possible against COVID-19. While herd immunity is nearly realized in Metro Manila, vast areas elsewhere in the country remain vulnerable as vaccination drives there bog down because of poor healthcare systems that have been neglected and underfunded long before the pandemic. Recently, our columnist in Cebu, Marit Steinus-Cabugon, wrote about the slow vaccination drive in Central Visayas that she blamed partly on insufficient medical personnel to administer the injections. She also blamed vaccine hesitancy, which we will return to later. We have heard similar concerns when Metro Cebu experienced its last COVID-19 surge. Reports in the capital focused on the lack of oxygen supply and hospital beds, but a local official later clarified that their actual concern was not having enough doctors and nurses to care for patients. Cebu is the most significant city after Metro Manila, and as such, whatever problems it faces are likely felt in many other areas of the country. As mentioned in previous editorials, the pandemic has exposed the many weaknesses of the country's healthcare sector. According to the World Bank, the Philippines only has 0.6 doctor for every 1,000 people as of 2017. Compared to other lower middle-income countries, the average is 0.8 doctor per 1,000 people. That is the same ratio in Thailand and Vietnam. Myanmar, which is grappling with the civil war, has a slightly better ratio of 0.7 doctor for every 1,000 people. The Philippine situation is only a bit better than Indonesia, Laos, and Cambodia, but far behind Singapore, Brunei, and Malaysia. Of course, the Philippines aspires to be an upper-middle-income country, and the doctor-to-patient average ratio in those countries is 2.2 to 1,000, based on 2017 data. High-income countries have an average of 3.1 doctors for every 1,000 people. In terms of nurses, the Philippines is doing better, with 4.9 for every 1,000 people as of 2017, according to the World Bank. That is higher than most of our neighbors in Southeast Asia, even better than upper middle-income countries, where there are only 3.7 nurses for every 1,000 people. As we reported recently, though, Filipino nurses are leaving the country in droves. Worse, fewer are joining their ranks because the pandemic has also disrupted the education system and delayed qualifications testing required by the government. Also, the distribution of nurses is skewed in favor of Metro Manila and highly urbanized cities. That may offer little comfort to those in urban areas, particularly those who could not find hospitals able to admit patients at the height of the recent COVID-19 case surges. According to the World Bank, the Philippines has 4.9 hospital beds for every 1,000 people as of 2018. In Southeast Asia, only Singapore and Brunei ranked better than the Philippines, and the average ratio for upper middle-income countries is 3.7 beds to 1,000 patients. But we still have a long way to go. High-income countries have a ratio of 11 hospital beds for every 1,000 patients. Takeaways. These figures provide some key insights. First, we should be skeptical about blaming vaccine hesitancy for the slower rollout in rural areas. As Ms. Steinus-Cabugon wrote, vaccine supply seems adequate. We run the risk of those precious doses expiring if they are not injected into arms soon. As we said in a previous editorial, we hope that vaccine hesitancy will not be used as a cover for ineffective logistics management by the authorities. Second, the next administration should prioritize public health in its infrastructure development plan. Besides hospitals and clinics in rural areas, we need to upgrade and modernize existing facilities. Lastly, the country also needs more doctors and a steady supply of nurses to compensate for those who decide to work abroad. But even as the system churns out more doctors and nurses, we should remember to produce competent medical professionals. Quality, of course, requires investments in their education and training. Granted, our ideas are not new. The challenge for policymakers is remembering them when times are better, hopefully before the next major health crisis. And that's editorial for Monday, November 1, 2021. For more news and information, get a copy of the Manila Times on print, subscribe to our digital edition, or log on to www.manilatimes.net. Follow us on Twitter, Facebook, and Instagram, and listen to The Voice of the Times.